Greetings to my fellow classmates and Dr. Mazani bin Muhammad Yusuf. I am LOGEETHAN, son of SATASIVAM for Bachelor of Health Science. My research focuses on awareness and compliance with hand hygiene practices among future healthcare workers in Malaysia. This topic is vital because proper hand hygiene remains the single most effective and affordable method to prevent healthcare associated infections. As future healthcare providers, students' habit and attitude formed now will shape their professional conduct and influence patient safety outcomes. Hand hygiene is globally recognized as a critical infection prevention practice. The WHO's Clean Care is Safer Care campaign and 5 moments for hand hygiene model highlight its importance. However, despite training and guidelines, compliance remains inconsistent, especially among healthcare students. They may know the protocols but fail to consistently apply them in practice due to factors such as lack of supervision, peer influence, or time pressures. Studies show that healthcare students often understand the importance of hand hygiene but do not practice it consistently during clinical sessions. This gap between knowledge and behavior poses a significant risk to patient safety and can lead healthcare-associated infections. In Malaysia, there is limited recent data on student compliance, making it difficult for educators and policymakers to implement targeted interventions. The aim of this study is to assess both awareness and compliance with hand hygiene among healthcare students. Specifically, I will evaluate their knowledge, measure actual compliance, identifying influencing factors, explore the relationship between awareness and practice, and finally provide evidence-based recommendations for improving training in Malaysian healthcare education institutions. International studies from Europe, Asia, and Middle East consistently show a gap between theory and practice. Factors such as time constraints, poor role modeling by senior staff, and lack of feedback contribute to low compliance. The COVID-19 pandemic temporarily boosted awareness and training, but whether these improvements are sustained is unclear. In Malaysia, research by Malaysia researchers and others found that while most students know the WHO 5 moments for hygiene, only a minority comply consistently. Post-COVID, there's been no comprehensive national level study on students' behavior. This research addresses the gap. Based on previous literature, I hypothesize the greater awareness would be associated with better compliance, and both institutional factors such as supervision and facility access and personal factors such as attitudes and motivation significantly influence compliance level. This study uses a quantitative cross-sectional survey with structured WHO-adapted questionnaire. Participants will be healthcare students from multiple disciplines and universities. A straight-forward random sampling method ensures representation by field and years of study. The questionnaire covers demographics, awareness, compliance, and influencing factors, and also will be validated and pilot tested for reliability. Data will be analyzed in SPSS software. Descriptive statistics will summarize awareness and compliance level. Chi-square tests will explore categorical relationships such as t-test or ANOVA, which will compare group differences, and Pearson correlation will assess the link between awareness and compliance. A significance level of P below 0.05 will be used. These research will fill a key knowledge gap in Malaysian healthcare education, particularly in the post-COVID era. It will help improve curriculum design, strengthen training strategies, and guide institutional policy on student compliance monitoring, ultimately enhancing patient safety. Thank you, and I welcome your questions.